to be doing a dressing change. And one of the first things you want to do is you want to look at the chart and see what kind of wound you're dealing with, if there's any packing in the wound and how much of it. And so the first thing you're going to do is you're going to pre-medicate your patient 30 minutes beforehand, because this is going to be a painful procedure. And so you're going to gather your supplies and you wash your hands and you put gloves on. You're going to take the old dressing off. And when you take the old dressing off, you're going to work from the outside in, removing the tape. And if the dressing is stuck on there, you can soak it with tap water or normal saline, because you don't want to disturb any healthy tissue on there. So you're going to take this off, and you're going to assess the wound. You're looking for color, exudate, odor, any characteristics, any necrotic tissue. And so you're going to take everything and throw it away. You're going to put new gloves on, wash your hands, and then you're going to irrigate. So to irrigate, you're going to put a linen saver pad down and preferably a basin. Before you do that, you're going to measure the wound. So you're going to go from head to toe and hip to hip, and you're going to measure it in centimeters, and you're going to see if it's not a perfectly round wound. You're going to just measure it from there to there and from side to side. And then if there's any tunneling, you're going to get a sterile swab, and you're going to measure the tunnel, and you're going to mark it with the end of your finger, and you're going to measure it in centimeters, and hopefully you have a buddy to help you mark that down. And then you're going to irrigate it. So you have your linen saver in a basin there, and you're going to use sterile saline, and 2 inches from the wound, starting from the interior to the posterior, to help gravity flow the irrigant down. You're going to irrigate it back and forth, side to side, until it runs clear. And then if you need to get a culture, you're going to get your little tube with your culture swab in it. You're going to make sure that the tube is labeled with the patient name, date, time, place, all the pertinent information. You're going to take it from the tube, and you're going to get the granulated tissue only. You're not going to do the eschar or the slough in it. You're going to put it back into the tube, and if it has a little ampule in it, you need to break that ampule and then send that off to the lab. And so now you're going to redress the wound. So you're going to take your gloves off and wash your hands again. And so you come over here, you've got your sterile kit. So it's going to be away, towards. You can only touch the quarter inch edges of your sterile field. This I don't need, so that's going to go in my biohazard bag. I'm going to move my gloves over here. And I'm only going to put one of these on right now. I'm going to put it on my dominant hand. So I'm going to pick it up here, touching only the inside, and struggle to get it on. This is good enough for right now. So I'm in my sterile field. I don't want to cross anything, but I do want to move this over just a pinch, because I want some room over to my right. So my ABD pad goes over here, and I want to keep a couple of 4x4s dry, and I want to get out my tweezers, and a Q-tip. So now I'm going to come back over here, and I'm going to grab my normal saline, and my gauze pads are already in there. So what I'm going to do is, with my non-dominant hand, I'm going to loosen this, pour my sterile saline in, come back over here, because now I can get my other glove on. So without touching anything else. So now, since I'm still sterile, I can redo my gloves without touching anything else. I only want to touch like my fingertips. And this is just going to have to do. So what I want to do is I can take some of my gauze. He only had one piece of gauze that came out. So my saline soaked gauze, I can wring this out because I want it damp but not wet. And then I can put it in my tweezers. And then if I need to, if there's any tunneling that I need to pack this into, I can use this to pack it in. Don't touch the wound with your tweezers. You just want to gently pack it in. Okay, now I can get my dry 4x4s. And put it over the wound, not touching anything else. And then I can grab my ABD pad. And then I can place it on top of that. And now I can put on a pair of normal gloves that fit. Because if I can't tape around the edge of the wound, I can do Montgomery straps. You still want to wash your hands and put gloves on, but how you do Montgomery straps is you're going to take a length of tape and you're going to fold it about a third of the way down, and then you're going to fold it again and make a little tear in it. So what you want to do is you can tape that there and tape that there so that there's less tape there. And then you want to take your long gauze and thread it through both of the holes. Of course, I would have gloves on and this would actually fit, but I'm operating on a sloth. So then, when you tie this, you don't want to have the knot on the wound because that would cause more pressure on the wound and delay healing. Instead, you want to have that knot over on the sides. And then you make sure that he's comfortable and you make him an appointment for his next wound dressing, and that's it.